Yeah, things are pretty bad. But having said that, the good news is that the number of infections is certainly coming down. It used to be close to about 400,000 on a daily basis. I think the peak has been reached and it's been going down. But the situation is still bad because essentially there have been a number of deaths. There is indeed a shortage of oxygen, and there is an urgent need to vaccinate the population. So that the government is taking all the measures to make that possible. And there is a lot of help coming in from other countries. There's a lot of help coming in from corporates. So a lot of corporates in India itself have diverted a lot of production facilities for manufacturing oxygen and making this available. So the entire country is kind of galvanized into action. But yeah, so things are becoming better slowly, but there's still a lot more to be done.
Do you feel that therapies that you are developing and that others have developed will be sufficient to be able to cover and give protection against future variants, or do you think that the jury is still out on that one?
So we have been working with, in fact, with a lot of big pharma to kind of in-license the more current drugs. For example, we just got baricitinib from Eli Lilly. We have also, working with, talking to, in fact, the other pharma companies, bigger, in other parts of the globe to get molnupiravir and so on. In our own case, for example, you have a product known as etanercept, which is actually a TNF-alpha inhibitor, and that actually helps in triggering a response for stopping the cytokine storm, which actually impacts the patients. This is something that the authorities in India have given us permission to try it out on patients so that it can actually be used. So we are doing a bit. We are doing a bit in terms of trying to license products. At the same time, looking at whether our existing products can be repurposed for attacking this disease.
Right. You made the point about how the situation has really galvanized everyone, every stakeholder into action in India and really stepping up their game, so to speak, to deliver in this need of the hour. What about keeping supplies going and the distribution and allocation of drug supplies across states? Because I believe there was a fair amount of chaos happening on that front. Have things settled?
So the short term, obviously, there is a problem because we need to get a lot of, vaccines in as early as possible. There's, of course, a shortage out there. There's no shortage of production facilities. The issue is, of course, on the drug substance itself. For example, we have a fill-finish facility. So do a host of other companies in India. But the question of getting the drug substance which will actually make this drug possible. And that is, of course, an issue. So we need help from potentially how fast can we actually manufacture that drug in order to get things going for us.